A baby's nighttime cries are something that almost every parent has experienced. It's a familiar sound, sometimes a gentle whimper, sometimes a full-blown sob, and it can leave you feeling anxious, exhausted, even helpless. But why do babies cry at night? And more importantly, how can you quickly soothe your baby and help the whole family get some precious sleep? First, remember that crying is your baby's primary way of communicating. In the first few months of life, your baby can't talk, can't point, and often doesn't even fully understand what's going on around him. So crying becomes his only way of communicating his feelings, needs, and discomfort to you. When you hear your baby cry, it's not a sign that you're doing something wrong or that he's trying to get you down. It's simply his way of saying, I need something, or I'm not okay. There are many reasons why babies cry at night. One of the most common is hunger. Newborns have very small stomachs, and they need to eat frequently, even at night. When your baby wakes up and feels hungry, his crying will signal to you that it's time to feed. Especially in the early weeks, your baby may need to feed every 2 to 3 hours, even in the middle of the night. However, hunger is not always the cause of crying. Discomfort from a wet or dirty diaper is also a common cause. A wet or soiled diaper can make your baby feel uncomfortable, itchy, or even sore. Sometimes a clean diaper will immediately stop crying and help your baby fall asleep. However, hunger is not always the cause of crying. Discomfort from a wet or dirty diaper is also a common cause. A wet or soiled diaper can make your baby feel uncomfortable, itchy, or even sore. Sometimes a clean diaper will immediately stop crying and help your baby fall asleep. Another factor that can make a baby cry at night is the feeling of loneliness or the need for closeness. In the womb, the baby is always surrounded by the sound of the mother's heartbeat, warmth, and gentle rocking. When out in the world, everything is strange, vast, sometimes making the baby feel insecure. That is why many babies only need to be picked up, held tightly in the arms of their parents, or heard a gentle lullaby to stop crying and feel secure again. Sometimes, babies cry because they are tired but don't know how to self-soothe. Some babies can fall asleep when they are tired, but others become irritable and cry when they are too tired to self-soothe. In these cases, creating a quiet environment, dimming the lights, and using consistent sleep routines can be helpful. It is impossible not to mention the problem of stomach pain, bloating, or gastric reflux, quite common causes of babies crying at night. Babies often swallow air while feeding, or their digestive system is still immature, easily causing stomach pain and discomfort. Signs of recognition are prolonged crying, legs drawn up to the stomach, red face, or possibly burping, vomiting after eating. Sometimes your baby's crying is a sign of a more serious health problem, such as a fever, infection, or allergy. If your baby's crying doesn't stop, is accompanied by signs such as a high fever, refuses to feed, has difficulty breathing, has a rash, or otherwise appears unusual, you should take your baby to see a doctor immediately. So how do you quickly soothe a crying baby at night? First, stay calm. A newborn's crying can be stressful, especially if you're sleep deprived, but babies are sensitive to their parents' emotions. If you're anxious or irritable, your baby will have a harder time calming down. The first step is to check the basics. Is your baby hungry? Is it time to feed? Is the diaper wet or dirty? Is the room too hot or too cold? Are your baby's clothes comfortable? Are your baby's arms or legs caught in the crib? After ruling out the above causes, try the following to soothe your baby. 1. Pick up your baby and hold him close. Skin-to-skin contact helps your baby feel safe, warm, and comfortable. The familiarity of your heartbeat, breathing, and body odor will help your baby calm down quickly. 2. Gently rock or pat. Gentle, steady movements similar to those in the womb will help your baby feel comfortable. You can hold your baby in your arms and rock him or her, or use a rocking chair to gently rock him. 3. White noise. The sound of a fan, a hairdryer, or soft sounds that simulate the mother's heartbeat can all help calm the baby. There are also many white noise machines on the market specifically for newborns. 4. Swaddling. Many babies feel secure when wrapped in a soft blanket, similar to the feeling of being wrapped in the womb. However, swaddle gently, not too tightly, and always put your baby to sleep on his back. 5. Sucking on a pacifier or breastfeeding. Sucking helps your baby self-soothe and relieves discomfort in the gums or stomach. 6. Change sleeping position. Sometimes just changing positions, putting your baby on his side a little or raising the head of the bed will make him more comfortable, especially if he has mild reflux. 7. Gentle massage. Gently massaging your baby's belly, back, or limbs helps them relax and can reduce colic and bloating. 8. Create a regular sleep routine. Try to put your baby to sleep at a fixed time, with repetitive activities such as bathing, changing clothes, singing lullabies, or reading books. This helps your baby recognize that it is time to go to bed and fall into a deeper sleep more easily. 9. Check for signs of illness. If your baby cries a lot, cannot be comforted, and has unusual signs such as fever, constant vomiting, refusal to breastfeed, or rash, take your baby to see a doctor to rule out medical causes. Some other tips can also be helpful when soothing a crying baby at night. First, pay attention to your diet if you are breastfeeding. Certain foods such as milk, soy, cabbage, onions, and coffee can make your baby gassy or uncomfortable. If in doubt, try eliminating one food group at a time from your diet and see how your baby reacts. Also, limit overstimulation in the evening. Bright lights, loud noises, or excessive play before bedtime can make it difficult for your baby to fall asleep and can make it easier for him to wake up in the middle of the night. Create a quiet, dark sleeping environment with soft lighting and soothing sounds. For babies who cry at a certain time every night for no apparent reason, they may be going through a phase of colic. This condition usually occurs in babies from 2 weeks to 4 months old, manifested by prolonged crying, for no apparent reason, often in the evening. Although it is a big challenge for parents, remember that colic is not a dangerous disease and will go away on its own as your baby gets older. During this time, be patient, ask for support from your family, and don't hesitate to see a doctor if you feel too stressed. Another important thing is to take care of yourself. When you are tired and stressed, things will become more difficult. Don't be afraid to ask relatives to help look after the baby so you can have time to rest, or simply go out to breathe fresh air. The spirit of parents greatly affects the emotions of young children. Finally, trust your parenting instincts. No one knows your child better than you. Although you may sometimes feel bewildered and confused by your baby's cries, with love and patience, you will gradually learn to recognize each type of cry and each different need of your baby. Each time you successfully calm your baby, you and your baby grow together. Remember, your baby's nighttime crying is completely normal, an inevitable part of parenting. Over time, those sleepless nights will become less frequent. Your baby will grow up, learn to sleep on his own, and you will look back on those early days with special feelings. Be patient, loving, and always listen to your baby, because every cry has its own message, and each successful soothing is a small but meaningful victory on the journey of raising a beloved child. In this video, we want to impart knowledge to mothers. If you find the video useful, please subscribe to the channel and turn on the bell.